The role of a pediatrician in a child's health and wellness journey cannot be stressed enough. Hello everyone and welcome to the Now in Times Talk from the Heart. Our guest today is Goa's one of the most senior pediatricians, Dr. Harshad Kamat. Dr. Kamat, welcome to our show and thank you so much for coming on our show.
Thank you. Pleasure is mine.
Tell us a little bit about your background. I know you have studied in Bombay and you've been practicing. You're basically from Margao.
That's correct, yes.
Right? Tell us a little bit more.
So I did my medical education in Grant Medical College, that is JJ Group of Hospitals in Mumbai. And post my MD, I have practiced in Margao for the last 30 years now. And I was fortunate to have the gold medal from the Mumbai University. But I think the last 30 years that I have gained a wealth of knowledge, experience, and that's what I'm here to share with you. Also, I represent the Indian Academy of Pediatrics, which is about a 48,000 strong body representing the pediatricians of the country. And I was the president of the Indian Academy of Pediatrics Goa State Chapter for the last 2 years. I've just relinquished charge now. But it was a proud moment for me to represent the IAP also.
Of course. You have been practicing a little more than 30 years, right? Fever, cold, upset stomach, diarrhea are some very common conditions, ailments with children. In the last 30 years that you've been practicing, have you come across any new diseases, ailments, common conditions in children that are becoming more and more common today?
So you're absolutely right. The commonest group of infections that a pediatrician is likely to see are the respiratory group, that is your cough, cold, fever, and the gastrointestinal group, that is fever, vomiting, tummy pain, loose motions. Often there's an overlap of these two. But what is important is most of these are caused by viruses. And when there is a sort of an epidemic or a large scale, usually it's a viral infection. Generally, we believe that out of 10 infections a child would get, 7 to 8 are viral, maybe 2 are bacterial. Why that is important is because we end up giving an antibiotic only for a bacterial infection. So maybe out of 10 infections, we need to give antibiotics for maybe 2. 7 to 8 are viral infections. Most of them are innocuous. Some can have a complicated course. So our job is to find out whether it's a viral or a bacterial infection and whether the child is progressing on course which is natural or is it going in an alternate, more deviant course where we need to intervene. So to answer your question further, yes, the spectrum of illnesses have been changing. For instance, a lot of it is to do with the fact that vaccinations have come about. Also, the quality of life of people in general, hygiene, awareness has increased. So there has been a kind of a shift in the epidemiology of diseases. So diarrheas have reduced, malaria has reduced, but dengue has increased. So there are changes in the landscape that occurs. And a large is to do with the kind of lifestyle that we follow. What is increasing a lot is not infections, but obesity, related to screen time, behavioral problems. These are increasing a lot and quite worrisome, I might add.
Of course. We will take that, as we speak. But right now you spoke about these new ailments and conditions that have come. One of them that I have heard, someone recently was speaking about measles, and he says measles is not very common, but there are some children who do get measles. Can you tell us a little bit more about measles? First and foremost, is it contagious? Do we have to stay away from, the child, or because the parent cannot, of course, the caregiver has to be there, but have the others to stay away? Is that
So it's a very
required?
interesting question that you have raised, Maria. The fact of the matter is, measles in Konkani is called urure.
Yes.
Is a very, very old disease. Now, what is interesting is that we have a very effective vaccine for it. It's the MMR vaccine that covers for measles, mumps and rubella, the MMR vaccine.
Right.
If your child has got 2 doses at least of the MMR vaccine, your child is protected against measles. The problem is what happened is during the COVID days, lot of disruption happened in the vaccination program. A lot of people could not go and there was a lot of scaremongering. So a lot of children have got a disrupted vaccine schedule.
Right.
And that resulted in increase in the cases. Now bear in mind, measles is a highly infectious viral disease. In fact, it is more infectious than COVID. So that means it can spread very easily. It's a respiratory spread virus. And the features of that, you get high grade fever, cold, cough, red eye and rash on the body. So this disease is nasty for children because it causes pneumonias, it can cause brain infections, it can have long-term problems, and sometimes the immunity goes down and TB comes up in children because of measles. Now you might have seen in the papers recently that there's an outbreak in Texas, in the US. A child has died in a first world country. Vaccinations is there. That is the reason why vaccination is very important, especially for diseases which can be prevented. The cure for a virus is that we don't have an anti-drug for a measles. But you identify the problem early. We can treat the complications like a pneumonia or the infections in the blood that might take place. But sometimes the brain infections can be very difficult to treat. Vitamin A, antibiotics, these are what we use. So to answer your question, there is no reason to be scared about measles. Most of our children are protected because of the vaccination. A very effective vaccine exists, but it needs to be administered.
Taken on time.
On time,
right.
Minimum of 2 doses. IAP recommends 3 doses. The government of India is giving 2 doses, but at least 2 is necessary.
Doctor, you know, most often what happens, I don't know if the audience agrees with me, parents are completely at sea. They are at the mercy of doctors, so as to say, because they are like, okay, now which are the vaccines? They don't know. I think that when parents are expecting, they need to be, educated about what are the vaccines and when they are to be taken.
Absolutely.
As a parent myself, I actually used to get hyper thinking, when is the next vaccine? I used to keep checking my daughter's card, to check. I hope I've not forgotten it. Parents get stressed because when a child falls sick, it is not just the child falling sick. You know that very well. The parent too is not completely okay because you see your child not well, it gets to you. So you just spoke about measles and the vaccines that you were talking about. Don't you think it's a good thing that we do, that parents are told about this?
Right, you are spot on that, Maria. In fact, I totally understand what you are coming to, and I guess you're asking me what are the vaccines that really required, and what are vaccines probably not that required.
Absolutely.
You see, the whole point is today, and this whole controversy happened years ago because of MMR vaccine. It was propounded by some that MMR causes autism.
Oh.
And that is where the whole issue, but that whole theory was debunked. In fact, there were some countries in the Europe which stopped the MMR vaccine, and 2 years later they found that there was no reduction in autism and the cases of mumps, measles had jumped manifold. So we know for a fact, and that theory has been debunked, that MMR causes autism. So that is one part of the story. Now there are certain vaccines given by the government of India in the national program, but all the vaccines recommended by the Indian Academy of Pediatrics is a little different from that, because the onus is on us as pediatrician to advise you as parents as to what are the available vaccines. What the government does is that it goes through a feasibility study to realize what are the vaccines that they can give, because you see, you may have one child to think of. Government has 25 million children of the whole country to think about. So they need to make provisions for that many doses and go through the logistics of arranging finance for that.
Right.
So to make a clear point, at the time a child was, say, 15 years back, the government was not giving hepatitis B vaccine. That came back. They were not giving penta vaccine. That has come later. They were not giving rotavirus vaccine. They were not giving pneumococcal vaccine. All these we were giving. So over the last so many years, today's babies who are born is given all these vaccines over what they were given. Earlier was only BCG, polio, measles and tetanus, DPT. That's all. But now you see the number of vaccines government is giving is a lot more. So they're coming more and more to all the vaccines that we have been giving. To tell you another point, typhoid And HPV, the human papilloma virus for girls' cervical cancer, is approved by the government of India. Today, when people come to us, government is also, they call it optional vaccines. And this word mandatory, optional, I think are misconstrued. Let's all call it essential vaccines.
Right.
All vaccines are really necessary. But the government will introduce one by one after feasibility studies. And so they will incorporate typhoid and HPV in the near future. When? Time will tell us.
Right. This HPV vaccine that you spoke about.
Yes.
Is that given to girls, to female children, or is it given much later?
So, HPV stands for human papilloma virus.
Right.
This is the this is the virus responsible for cervical cancer.
Right.
Also, it is responsible for vaginal, vulvar, anal, and the oropharyngeal cancers. Now, it is not only the girls who get this, it is the boys who can get penile, scrotal, anal, oropharyngeal.
Okay.
It's a virus which is there all over the world. We call it a cosmopolitan virus because it does not affect the poor or rich, it's there for everybody.
No boundaries.
There are no boundaries. So the thing is that prevention is the best strategy.
Right.
The age at which this vaccine is recommended is for girls and boys between the age of 10 to 14 years. Now, boys is a touchy subject because you see, if there are 5 to 7 girl cancer, cervical cancer, there will be 1 male cancer. The ratio is that much more. So our focus is essentially on the girls. Boys, we talk to some parents want to take it, then we will say it is available for them. And we now have different vaccines available for HPV. The right age to give it is from 10 to 14 years, but it can be given as late as even 45 years. But the efficacy or the effectiveness is higher when you give it to a younger person. So the girl of 10 to 14 is our first target.
Now, you said that you give it between 10 and 14. Are parents bringing their children, their daughters?
So the awareness is slowly increasing. People are getting aware of it. In fact, let me tell you, the WHO has recommended it strongly, and they are now recommending it to be given a single dose. But it works only when it is worked on a national program. Many countries in Europe, Australia, Canada, USA are giving it in the national program. That means they're giving it to everybody.
Right.
Our country is looking to start it. So NTAGI, which stands for National Technical Advisory Group on Immunization, is the government body. You might have heard of it during the COVID time. They were the ones making recommendations for the COVID vaccines.
Right.
So the NTAGI has actually made the recommendation to the government of India to incorporate the HPV vaccine in the schedule. But again, when it is going to happen, implementation, that logistics has to be still worked out.
Fine. Now let's come to we have been speaking about, a little complicated conditions. Let's speak about common conditions, like parents who are watching, I'm sure are waiting for this question. When my child gets fever, the moment I touch my child and I know there is a temperature, I am already getting worked up. My baby has fever, or my child has fever. The first thing I used to do, for at least what I used to do, was give crocin syrup at that, because she was a baby. But besides paracetamol, how else can we, because right now even with certain paracetamols there's a lot of controversy. So besides the paracetamol, is there anything else that we can do? Are there any home remedies?
So you touched on a very important topic, and I think I will dwell on this for a while, because this is really the subject where I see most mistakes happen in my practice. And I see parents really getting worked up and they approach this problem. First mistake that I find is that they don't document the temperature. Now, the sense is that if you touch the forehead and it is hot, that is fever. It is not so. In children, especially the younger children, the head is the heat losing part. And if it is very hot, for example, ambient temperature is high, like in summer, the child's head will feel hot, but that's not fever. So I always request all my parents who come with the children, please document the temperature by putting the thermometer. Nowadays, the mercury thermometers are not available, they are banned, so you get digital thermometers.
Right.
Putting it in the armpit and recording is the way to record a temperature. The forehead thermometers, the ear thermometers are not really reliable, or even that matter, those guns which came about during COVID times, not reliable. Digital thermometers. So first, my earnest request to all our listeners is please record the temperature, because you will make errors otherwise by just touching the forehead. You may not have fever, or the fever will be very high, you may get less of the temperature. So please document fever.
Right.
We need as doctors to know what is the kind of fever, what is the pattern of fever, what is the trend of fever. So documentation first. The second mistake that I find parents do is that they panic at the slightest fever. Now this is the most important point that I want to make. As you mentioned, fever is our friend, not our enemy, because it's our body which is producing the fever to take care of the germs. As you know, heat is counterproductive to germs. Heat will either kill them or not allow them to multiply.
Right.
So if my body has some fever, actually that is protective. If I use very strong medicines and bring the fever down to negative, in fact, I see sometimes some parents have given strong medicine, the fever is, baby's cold. What are you doing with that? You are actually helping the germs multiply. Also, please remember, we have white blood cells which fight. These white cells become more effective if the body is warm. In a cold environment, the WB cells cannot function as well. So allowing little bit of fever in the child is fine. When is it a problem? So, let's say normal body temperature 99 and below, acceptable.
Right.
100 and above, you need to medicate. 99 to 100, the low grade fever, allow it, that is fine. Any fever which is like 103 and above, that is called high fevers. Now you really don't need to break your head trying to record this. What I really make a point here is allow little bit of fever, that is fine. The drug of choice, this is the third mistake, is paracetamol that you said. Crocin, Calpol, Dolo, these are brands that I use. But please use the right dose. See, what happens is a child comes to us, next time yearly weight has increased, the dose will change. If you use the wrong dose, it may not work. So you need to know what is the right dose. Talk to your pediatrician, find the right dose, but please use paracetamol first. People use drug like Meftal or that's mefenamic acid or ibuprofen or combination, which are the worst. Because when you use this stronger medicine, not only will have side effects more, plus you will bring the fever down to a level which you think, oh, maybe
it's fine,
but it's worse.
Okay.
So these are the things which I need to make point about. One other issue is sponging. There's a whole tendency to start sponging the child immediately. Please understand very simply, first rule, it's tepid water sponging, means lukewarm water. Please do not use ice water. Somebody goes and dunks the child into the bathroom and starts pouring water on the child, or they put ice on the child. That's not to be done.
Right.
There is no need to put yodacolone, alcohol, Feni, all these type of things they do.
But we have grown up with that, you know that.
When do you sponge? Exactly the point. You need to sponge for high grade fever.
Right.
After you have medicated the child, when the child is not shivering, and when the hands and feet are warm. Why do you do that? Basic physics. You wipe the child with a thin putty, allow the water to evaporate, takes the heat out. Now you put cold water on the child, what will happen? The skin goes cold, the heat gets trapped inside the body, and the parents always tell us, no doctor, I sponged, it was 102, came to 101, again it bounced up. See, you're not allowing the heat to dissipate. So first step, document fever, use paracetamol if the temperature is 100 or more. If the child has warmed up, hands and feet all warmed up, no shivering, you can sponge baby, use tepid water. Do not use ice cold water. That are the important points with regards to fever. Important point I need parents who are listening to us to understand is what fever is worrisome. 103 fever, child running about playing, not worrisome. 100 fever, child dull, lethargic, is worrisome. Because what is more important is to know what is the behavior of the child. A child running, playing, doing the normal activities, that means it's a normal viral infection, child is doing fine. But if it's a sick child, even at 100, the child is listless, lying down, then it's just not the grade of fever. It's important to note what is the behavior of the child when the fever is there. That is very important to note. Also, if the fever is with other symptoms, child is vomiting, having coughing, rash on the body, then we need to know what else is going on. So they need to report to a doctor. So like I said, if they give all the right information, the doctor is a better position to make a diagnosis and treat. If you just tell me, oh, fever, but you don't tell me how much of the fever, what medicine you gave, did the fever come down along the, what are the symptoms, then it helps us to come to the right diagnosis.
That was my point when I said point number 4 is like, you have tried all these and you have done all this, and the next you have to go to the pediatrician. Parents panic. We all do. I know as a parent that I did. And when our children are not well, we are not well too, to a certain extent. Another very common condition, ailment, is an upset stomach and diarrhea. Some people recommend that you just give kanji and a little bit of soup. What should we do for diarrhea, doctor? Besides the medication, is there anything else?
So again, I think this is a common subject. I need parents listening to us to have a clear understanding that the diarrhea, which is watery loose motion, is the right word for diarrhea. When a child has loose motion, you got mucus or blood streaks in it, that is called dysentery. Okay. These are two different entities. Okay. Dysentery usually is a bacterial infection. We need to give antibiotics for that. Diarrhea, on the other hand, is usually a viral disease. So you do not need antibiotics. Right. Mostly self-limiting. But the problem with diarrhea is it tends to cause dehydration. Because they have watery motion, child will usually have vomiting and loose motion. The child does not feed properly and you get that. So the treatment, most important, what you need to use is oral rehydration solution, ORS. You get different brands like Electral, Prolite, multiple brands, but you need to give fluids. If your child is refusing to take these ORS because the taste, say, you can get homemade remedies like kanji, buttermilk, chas. You can also use clear soups. You can use nimbu pani, everything home. Please do not use aerated drinks and colas, and that is an absolute no-no. Milk is possibly incriminated by a lot of people that please don't give milk in diarrhea. Not true. It's only when the diarrhea becomes profuse and you get into a phase which we call lactose intolerance, that is when we suggest you go easy on the milk. Otherwise, milk can also be given in diarrhea. One is the fluid intake. The other thing about diarrhea that you need to give are probiotics and zinc. These are the only 3 items the Indian Academy of Pediatrics recommends for diarrheas. Whereas dysentery, on the other hand, is where we would use an antibiotic. So this is the clear distinction I would like the viewers to be aware of.
Right. So the dysentery is the one that you need to worry about.
Whereas because children can get very sick.
Right.
And the older children can, because of eating out habits, develop what is known amoebic dysentery. Smaller, younger children do not. It's the adolescents who eat out, they tend to pick up amoebic dysentery. Right. Where you might have heard Flagyl, Metrogyl is all given. In smaller children, we get bacillary dysentery. Anyway, that's for the pediatrician
to understand. Yes, our job as parents is to run to you all, and we need that helping hand. We need that assurance. But for right now, let us take a small break. Don't go anywhere. We'll be right back. Hello and welcome back to the Now in Times Talk from the Heart. We are in conversation with Dr. Harshad Kamat, one of the senior most pediatricians of Goa. Doctor, we were speaking about milk. There's so much. You don't, as a layperson, I don't know what to believe and what not to believe. What is your opinion about milk and children?
So, the breastfeeding, there is no controversy. Okay, every baby should be breastfed as much as minimum 6 months that we recommend, and you can continue till about 2 years. So the controversy is nothing to do with breastfeeding. The controversies are with regards to cow's milk and other sources of milk. Now please understand, humans are the only species of animals which takes milk of some other species. Yes. So it's foreign to our body. If mother's milk is not available, then it's a substitute. Now, 2 points here. Rather than, as IAP states, if a mother's milk is not available, then your next best option in the first year of life is a formula milk, which is as close to the mother's milk rather than fresh cow's milk. The reason being that the newborn will have a maximum brain growth in the first 2 years of its life.
Right.
At which point of time you need brain growth factors, immunity factors, and other ingredients which are present in this fortified formula milk and non-existent in cow's milk. Cow's milk, please, is for cows, not for human beings. After 1 year, it's okay, because by that time the child has so many other foods to have. Milk will become the small
Part of the diet.
So this is one point. The second point is, much unlike a lot of grandparents would think, milk is not important. It's essential only the first 6 months of the life, when it's easy to digest. Beyond 6 months, when all other foods start coming in, the role of milk becomes less and less. We see a lot of children who are having allergies to milk, or there's something called as lactose intolerance.
Yes.
So in which case children cannot tolerate it. It's okay for them to get milk products, for example, dahi, paneer, cheese. These they can tolerate, but the lactose part they cannot. So if the child cannot tolerate, they need not take it. The third aspect has come about with this advent of vegan diets. Many parents who are vegan, they do not wish the children to have.
Right.
The point here, as the IAP states, is that whereas vegan, lot of good foods are available and you can balance your nutrition as an adult because that is your choice. To impose a vegan on a child who is finicky or may not take all the foods, you will compromise on the growth of the child, because you need to have a balanced diet. Milk which is coming from soya milk or almond milk are not having all the nutrients required. There's a lack of, let's say, B12, there's a lack of iodine, calcium, iron. So you will need to balance it out. So in short, if you want to use any of these products, it's fair enough to ask an adolescent who is going to take a idea of doing vegan because he or she wants to do it, not an imposition. So milk is not as great as it was believed in the past. And also I want to make a strong case that the habit of giving milk to children before sleeping should be done away with, because when you have milk before sleeping, one is that milk is going to add a lot of calories into the child, especially when it comes to obesity as a problem and decay of the teeth, because milk has sugar. There's always sugar in the milk by itself, not what you add, and that can cause damage to the enamel. So if you give any food, it should be earlier, at least 2 hours before sleep, and they should rinse their mouth or brush their teeth before sleeping. That's very, very important.
All right. You just spoke about a very, very important topic. I think it is an epidemic in the world today, obesity. It is not just in the West. In Goa itself, obesity is showing its head everywhere. When you see a baby, you see a child that is obese, normally our tendency is so cute, oh my god, what a roly-poly. But now after reading so much, most of us, I'm sure our audience agrees with me, today we realize how bad that can be. What do you have to say about this obesity? How can we as parents bring about that change where our children are eating healthy and they are staying in that normal parameters of their weight?
Spot on, Maria. I think this is a very, very important, and you're right. It's an epidemic getting out of hand, and post-COVID, this incident has escalated. Now, the point is this, that what you mentioned, obesity is different from being overweight. Obesity means an BMI is in excess of 27, 28, whereas overweight would be somewhere between 20 through 27. The criteria has changed now. If one parent is obese, it's a 3 times higher risk for the child to be obese. If both the parents are obese, the risk is 8 to 10 times higher. There's a genetic element, there's an environmental element. Now, what I need our audience to be aware of is, when the child is born, there is a regular follow-up that takes place where the growth charting is done. When as a pediatrician we notice that the child is jumping its growth curves, it's early identification of a child who is becoming obese. Also, that's the time to intervene before the child actually becomes obese. When you start going off the curve, we know that obviously this child is at risk. So we talk to them about the right nutrition and the fact that you are, like you said, everybody likes chubby roly-poly and everything looks nice and
Lovely.
hunky-dory, but
Absolutely.
it's not so. The crux of the issue is nutrition. Balanced diet is the most important thing that the family should follow. When I say balanced nutrition, means there should be a good component of vegetables, fruits, 5 different fruits, 5 different vegetables, seasonal is what we recommend. We also recommend a good balance of cereals and pulses, legumes, non-vegetarian item if you are there. So each of these are like 1/3, and you should have milk and milk products. So if you have a balanced diet, and very, very important, please stay away from all the junk food. And from there comes our recommendation: no salt in the first year of life, no added sugar beyond up till 2 years. After 2 years, that is fine, because once these children who are growing get used to having salty and sweet foods,
Right.
they develop that taste. It's addictive.
It
And
is.
then it is something that you cannot control. So these are the things that one should do. It's a good habit. It's a good habit to make older children read labels. When you look at food, packet of chips for instance, you will see how much extra calories is there. You see how much of additional salt is there. You also realize there are lots of preservatives, there are coloring agents, there are flavoring agents. None of them are good in the long run. So when we have these school programs, we talk to the older children, we make them aware how to read the labels. What is normal range? 20 to 25 grams of sugar a day, not more than 4 grams of salt in a day. And you look at a packet, half the requirements come from one packet of chips. So what is junk food? All that is packaged, all the nice things what children love should be avoided. Should they avoid it all the time? No. Children are growing up, they will have once a week, we say is fine, but please don't have it on a regular basis. And this brings me to another important point. Disciplining a child will only happen if you set a good role example.
So
If you
true.
do not, if you stock your fridge with colas and have chips while you're watching a football or cricket match and tell your child not to have it, it will not work.
True.
So self-discipline. So in short, to answer your question, identify the problem early, good nutrition, balanced nutrition, avoid junk food, self-discipline, and please, this is the problem, at least 1 hour of exercise for a child is necessary. Today, because of screen time, everybody is indoor, that creates a problem. So exercise for an hour, avoid screen time beyond. For older children, we say, okay, not more than 2 hours recreational screen time. They have studies, they have to do their projects, but recreational screen time should not cross 2 hours. And the most important thing, adequate sleep. You will be surprised to know how many children have compromised sleep, because on the lights are out, they are on the mobile, social media, the sleep is compromised. So nutrition, avoiding junk food, exercise,
And sleep.
and avoiding screen time. These are the factors which will ensure obesity is controlled.
It is, you have enumered all of them, but not all of them are very easy to follow, because as a parent, of course, I am going to tell my child, stop with the phone, switch it off. Maybe they'll do it just now because, oh God, she is harassing me and nagging me. I will switch it off for now, but 10 minutes later you leave the room, 10 minutes later you come back, and parents watching will be nodding and saying, yeah, of course, and they are back on their phones. But we can always try.
I absolutely agree. It's easy to say this,
Yes.
difficult to practice in today's modern times, where school mandates, programs, projects, so many things are there, and it's quite necessary component.
Yeah,
And
we want to chill.
Frankenstein which we have created. And that is somewhere we are caught into.
The children keep saying, we want to chill, and you take a chill pill while we chill. You know how it is. And a new term that I've heard of late I don't know if our audience has heard of it. It's called virtual autism. Autism we have heard. We know ADHD, autism are some conditions that are now common. But what is virtual autism?
So that's a very important subject, and I think it's something that we are seeing more and more nowadays. Autism is basically a genetic disorder wherein a child does not have social skills of communication. Language is a problem, and there are behavioral issues, hyperactive, and they don't have emotional connect.
Right.
So this is what is
Autism.
It is a genetic problem. Virtual autism is because the child does the same thing, not because of genetic problem, but because of overuse of screen time. And when I say screen time, I'm talking about mobile, TV, laptop, computer, all together. It's a bad habit to introduce this in the first infancy, that is the first 2 years. We do not recommend it, because once the child, that is the problem today with nuclear families, the mother is working, the father is working, and you need to get your work done, and the child is sitting doing that. So the brain chemistry or the brain gets wired differently, and they focus on the screen time, and only that, there is no social connect. And that is why the child will be then hyper behavioral issues, no emotional connect, language delay, the child is rooted only to the screen. That is your virtual autism. The good thing is it's reversible. You need to stop this for it to be reversible. But again, the question then comes of disciplining.
Discipline.
And
it's a big
awareness is the first thing, and I would really like the audience to understand that this is a problem. Please do not introduce. It's easier and nicer to have books and the old way. Let's do things the old way. These gadgetry stuff is great for purpose, but it has its own problems.
You know, you mentioned about books. Recently, a friend of mine was telling me that she is buying a tablet for her niece who is 5, and I nearly jumped out of my skin, and I said, buy books, buy games, buy plasticine. Do you remember the clay that we used to play with? And she's like, no, she likes watching cartoons and playing games. And the trend is becoming today towards everything is digitalized. I want to give my child the best, and the best would be an iPhone, a tablet, and everything else. But you're right, doctor. We need to pull the rein somewhere.
Absolutely.
And we need to tighten that, and we need to take care.
Coming to that point, the Indian Academy of Pediatrics has some guidelines on this with regards to the screen time. So like I said, please avoid screen time below the age of 2 years, except for when it's occasionally, like you're making a phone call on say a WhatsApp call, and the child is also there. See, certain things are okay, but do not make a habit out of it. Beyond 2 years, say 2 to 6 years, do not allow them to have more than 2 hours of screen time. Lesser, the better. And in older children, where they have a lot of school projects and are there, we will say beyond your school curriculum projects which you are doing, there also 2 hours is the kind of meeting for social media. Now take it into perspective. 8 hours of school, 8 hours of sleep is required. The child is left with 8 hours. Out of that, she has to go for guitar classes or some sports practice or some extra this. How much time is left? We say out of that time, 1 hour of physical activity, 1 to 2 hours with family time. That is very important. That
is becoming a lost trend.
Well, it's something like it's gone into the back ages.
Yes.
So you should not go beyond 1 to 2 hours of screen time. So that is what, again, it comes to
discipline.
And disciplining starts with the parents themselves.
Right. So true. So true. We have time for just another couple of questions. One very important question that I need to ask you is fits, convulsions. There are some children who, when the fever goes high, I really don't know. I want to ask you about this. Can you tell us what causes these convulsions? And at home, what do I do before I start going absolutely ballistic? What should I do as a parent if my child starts getting convulsions, fits?
So let me put things in perspective. There are 2 types of convulsions. One is what is called fever related or febrile seizures.
Okay.
That means it's the fever which is causing. and the other is without fever. So
Alright.
the ones which are without fever are called epilepsies,
Yeah.
a genetic factor, or it can be just de novo coming to a child. Whereas the febrile convulsions usually are genetic. That means one member in the family, either the mother or the father, would have had this kind of convulsions when they were children. The good part about these febrile seizures is it is time limited. Usually starts around 1 year to 5-6 years. Beyond 6 years, it's unusual. So it's only that period of time. It is triggered by a fever. So the problem is, of course, the first convulsion, because you are not aware, and
Yes.
that's where the problem is.
Absolutely.
Once the child has had a convulsion, gone to a doctor, we advise them what to not do or what to do for the next convulsion. But the problem, and I'm sure that's what your question is, what do I do for the first convulsion?
Yes.
So the first thing is, most convulsion will stop within a minute or two. That's the usual. Sometimes the convulsions can go longer. Those are the worrisome ones. But what you should do is get the child to lie flat, turn the child to one side so that the child, if they vomit, should not get choked.
Choked. Okay.
Loosen the clothing. For example, I've seen children from school with a tie and all, everything is tight, they get choked. Loosen the clothing up, keep the child comfortable.
Right.
Do not form a crowd over the baby and completely smother the child. Somebody comes and pours water. Do not put anything in the mouth of the child. Okay, there's a habit of putting a spoon in the mouth. Do not put crushed onion or break an egg on the child. Lot of crazy things are done. None of these should be done. Yes, if the convulsion is, because I'm sure the moment the convulsion, people will be asking for help. While you arrange transport to the
Go to the
hospital
doctor.
or doctor coming, whatever is done, please ensure that this is done. If a convulsion is there ongoing, you can't, if a child with fever, for example, you can't give anything orally, the child is unconscious. You can use a per rectal suppository of paracetamol.
Okay.
That will bring the fever down. And we now have a drug which we use as a nasal spray. It's called midazolam. It's a spray
Okay.
which stops convulsions. So now this obviously we will tell a person, parent whose child has already had a
Already
convulsion.
had. Okay.
So once you have a convulsion, we will give them all the requisite information and the mechanism of preventing the next one. But for the first episode, yes, if it stops in a minute, it's fine. But then they still have to go to the hospital. If it doesn't, they will have to go to the hospital, but at least do these things what I've said just now.
And if it doesn't stop within 1 or 2 minutes, you're saying, then it's a little
In any case, you need
Worrisome.
to call for help and take the child
to the hospital.
There is no home remedy that you do. You cannot put onion or garlic,
Right.
egg, or
Right.
put water. All these are what I would say is not to do. To do is to ask for help and take the child to the hospital.
Right, right. And my last question to you is, you have given us so much of information. You have told us so many do's and so many don'ts. Is there one advice, one recommendation that you would like to give all the parents or going to be parents who are watching the show? Something that's really important.
So it's not one thing that I would like to, I will take permission to talk about 2-3 things.
Yes.
One is, of course, the breastfeeding is the most important thing which they should do for a newborn baby. There's a misconception that the mother has got cold, cough, fever, they should not feed because that will go, the virus will go to the child. It doesn't go through breast milk.
Okay.
The child has cough, cold, fever, through air contact, the baby may get it. But if you breastfeed, you could pass on antibodies too. So please breastfeed even if you got cough, as long as you can manage to do so. If you're feeling very sick, that's a different issue altogether.
Right.
So breastfeeding is very important. The other important thing which I find a lot of parents don't do is they do not maintain the records of the child. All visits, they may go to 10 doctors, but please keep all the records. It is a lot of information that is required. So if a child is getting wheezing again and again, I need to know how frequent, what was the time period, what was the medication given in the past. By not showing those papers, you are doing a disservice to your own child. Thirdly, they should keep the vaccine record, and I'm sure as you have a grown-up child, you will note that many students nowadays are going abroad to other universities. They all ask for records, vaccine records, and if you do not have your records, then it's difficult for us to maintain and give you fresh, because in India, vaccine records are from different sources, some from the government, some from private. So you need to maintain all the records for me to certify that your child is fully vaccinated. If you do not show me the records, how do I certify that your child is fully immunized?
Right.
So these are certain points, and what we've spoken a while ago. Screen time, please curtail it. Obesity is a problem. Obesity is going to be a bigger problem in ongoing period of time. We need to tackle these issues now.
Right. Doctor, with doctors like you who are guiding us and who are advising us, I am sure we can take the steps in the right direction. But like doctor said, it takes discipline. Not just only with the food and not just with our children and their screen time, but also in our own lives. Because if we as parents can do it, doctor said that as well. If we can do it, only then can we pass it on to our children. Doctor, thank you so much for speaking with us.
My pleasure.
It was so informative to all our audience. Thank you for your time, for your patience, and for your attention. Until next time, take care.